And welcome to the Dr. Bob Show. Do you have anything that bothers you? Like maybe do you get frightened when a mouse runs in front of you, or when bees buzz around your head, or when you're going to give a talk, do you get a little anxious? When does that problem become abnormal? We'll be spending most of the show talking about chronic anxiety disorders. When does normal anxiety become abnormal? My guest is Dr. Ken Jobson. Dr. Jobson is a board-certified psychiatrist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about what's the difference between a bronchitis cough and the diagnosis of emphysema, and how does diabetes really bother the eye and cause major eye problems. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Ken Jobson, board-certified psychiatrist, and we're talking about anxiety disorders. Ken, welcome to the Dr. Bob Show.
Thank you, Bob.
Is anxiety always bad, sometimes good, sometimes bad?
Well, anxiety is a response to perceived, real, or imagined stress, and so it can be either.
So stress sometimes is good. When would it be good?
Well, if there was a danger. You want to be alert and vigilant and make that a priority to tend to the danger.
So to be anxious around a snake coming in from you,
there you go.
It would be good. You get out of the way.
Or the tornado down the street that's coming your way.
That would make me very anxious, and it would make me seek safety. So when does their anxiety become abnormal?
When it's maladaptive. When it gets in the way of the quality of their life and does so with the length of time concerned enough to make the long-term happiness less.
Is it a common thing? Do you see anxiety disorders in society a lot?
It's the most common mental illness. Anxiety disorders as a group is the most common mental illness, so it's very common.
Most common, so it's out there a lot. So a lot of people have it, men, women?
Well, if you take all of them and lump together, women more than men, OCD is about equal. But most of the anxiety disorders is a preponderance of women.
So there's going to be different anxiety disorders. Let's list 3 or 4, and then we'll talk about each one.
Panic disorder, simple phobias, OCD, social phobia.
Now, OCD is obsessive compulsive.
It is, or it's some pure obsessive. But yes.
It can be just obsessive.
Yes.
Is there a generalized anxiety disorder?
It's one of the most common also, and that's just, some people call it the tense disease. Being tense or muscularly tight. And a lot of people go through life like that.
Whoa, I know a lot of people that are uptight sort of thing. I always tell people, well, I'm the quarterback, and the quarterback can't be panicked in a football game. So tell me about generalized anxiety disorder. What are they like, and how do they present?
Well, they usually present early in life. In fact, the anxiety disorders as a group often present early, sometimes in childhood, sometimes in adolescence. The peak of these disorders is usually 30 to 60, but it's an early onset. Generalized anxiety is a general sense of alarm or alert, or not be able to go off guard. Often people are muscularly tense, and with it have many other physical symptoms.
So if it starts at a young age, does it always persist, or can treatment intervene and guide somebody on, or is it hereditary disorder that's always going to be there?
Well, there are genetic predispositions, there are circumstantial predispositions, and there are personality or temperamental predispositions. Sometimes you see it going away or improve with the circumstance, for instance, or with the treatment of other conditions that may be the primary cause of the anxiety disorder.
When it starts at an early age, what are we talking about? Teenagers or below teenagers or before kindergarten even? Can you?
Well, it can be very early in childhood. It also can be onset throughout life, but the tendency is for it to come on either in middle, late childhood or before age 30.
How can the family members detect that somebody in their group has anxiety disorder? Is it easy? Is it obvious? Is it?
Well, there's so many presentations because it may come in as a complaint of a medical symptom or group of medical symptoms. A lot of the people that go to physicians have part or a substantial part of their illness be anxiety as the presentation, because almost any organ system can be perturbed and present with physical symptoms, and it actually be an anxiety disorder.
Are there medical problems like an overactive thyroid that can cause this? You know, in adult medicine, people with hyperthyroidism, they're shaken and they're hyper, they could present as anxiety?
A number of medical conditions, a number of other psychiatric conditions that are primary can cause it, or in substance abuse, there are conditions in which it may present. And in medicine, almost any organ system, if you take parathyroid, thyroid, lung disease can present as panic disorder. There are many, many conditions it can.
So it's important that you not only be a psychiatrist, but you be a physician to find these disorders or suggest them to the primary care.
Well, the evaluation will include a biologic evaluation, such as with a physician, a psychological evaluation, a social evaluation, and the context of the presentation, because it can be embedded in many other causative factors and many other types of conditions.
Is the outlook for somebody with generalized anxiety disorder, is the outlook good or bad? Take long-term psychiatric care, or we can help you?
Well, we almost always can help. And the anxiety disorders are treatable. That's the good news. Now, there's a staging of anxiety disorders like there is with schizophrenia or mood disorders. And so catching it very early, it may be easier to treat. And it depends on the matrix or the context of how hard or easy it is. The severity and the context.
So how does somebody pick it out? You know, if somebody's got it, how do people, I think you've got an anxiety disorder. I'm not going to tell you, but let's go see the doctor.
Sure, and often going to the doctor first may be the reason, because if, like you mentioned, hyperthyroidism, you sure don't want to miss that and think it's just primarily psychiatric or psychological. But you, having evaluated it medically, you also want to get an evaluation from a psychosocial point of view. And many of them present as primary.
I want to switch right now, we'll talk about treatment later, to panic disorders. Some people panic. When does it become abnormal?
When it gets in your way of your life on a recurrent basis or a severity basis. I mean, a number of people will have a single one or two in their life, and that's close to the human condition. But if it is recurrent, if it limits your life, if it starts causing you to avoid life, or have such severe anxiety, or be running back and forth to the emergency room.
That would be the typical people as we look at patients we've seen. Now, how about, what do they present? They may run to the emergency room afraid of something, but how do they present? What's an example of something?
Well, they typically think they're going to smother, die, or go crazy. And it may be that I'm going to die of a heart attack, that I've got some lung disease. It often presents with a tightness, a rapid heart rate, a rapid breathing rate, and a sense of a general alarm.
Wow, that would be frightening for somebody that had that. Is the outlook for that patient difficult, or is it good, or medicines can guide them along?
Well, a lot of things can guide them along. Medicines can guide along a lot, and also types of psychotherapy can guide them along. Or removing the offending agent. And we've been mentioning thyroid, but there are many other things.
So there is hope, and there is treatment, and there is improvement. Are there other anxiety disorders?
There are a number of them.
And that's what we're going to be talking about when we come back. There's a number of other panic disorders. We'll try and see what information we can get on those and see if there's treatment. You'll want to stay tuned. Wouldn't it be great if you never had to see your doctor because you were so healthy? Hello, I'm Dr. Robert Overholt, and I'm here to discuss the governor's initiative for a healthier Tennessee. Remember to be exercising on a regular basis and eat better foods, more fruits, more vegetables, and if you're smoking, stop. I'm Dr. Robert Overholt for a healthier Tennessee. We're talking with Dr. Ken Jobson, and we're talking about chronic anxiety, the most common mental illness that he sees in his private practice that's out there in mental disorders. There are lots of people that have chronic anxiety, a little bit more women than men, but both have it. We talked about generalized anxiety disorders, panic disorders, and now I always thought obsessive compulsive and post-traumatic stress disorder were sort of anxiety disorders. Is that correct or incorrect?
It has been over the years included, both of those have been included in anxiety disorders. It still presents with anxiety. The new Diagnostic and Statistic Manual separates them out, but they still have much in common with and have anxiety as part of their presentation.
And I look at somebody with post-traumatic stress disorder, PTSD, as somebody that's having nightmares and they wake up with, you know, fear and panic and this type situation. But it's been separated out, not an anxiety disorder because it's more serious? Or?
It's been separated out because of the symptom presentation and the wisdom of the committee that decided that, but there's still a lot of anxiety with it.
Okay, obsessive compulsive. You always hear in lay people talking, boy, he's obsessive. Or somebody says, I'm OCD, and you don't know if OCD, obsessive compulsive disorder, if they really are abnormally that way, or they're just more regimented in their activities.
It certainly is a continuum. And to go through medical school, you have to check and recheck and be rather obsessive. When it gets to be that it limits your life, when it takes away from the joy and adaptation of your life, you want to treat it. And in that case, you want to treat it very early, as in many illnesses. So it can be either helpful or not.
And you had mentioned earlier when we were talking with post-traumatic stress disorder, which is not an anxiety disorder, but there is treatment that's really been dramatic.
Oh goodness, yes. I mean, for instance, you mentioned nightmares. There's medicine that often stops that within a day or two. The bouts of awakening with rapid heart rate and smothering but not recognizing or not having a nightmare with it, those are very rapidly treatable. And if you get at the onset of something that looks like OCD, often a combination of psychoeducation, psychotherapy, and sometimes medicine can abort it and it not be there.
It amazes me about these disorders that we look at as sometimes so common and nothing works, that there's now stuff that works. I want to go back to anxiety. Talk to me about phobias. Is that an anxiety disorder?
Oh yes, in fact, simple phobias over towards a specific topic or agent is the most common of the anxiety disorders. And then there's social phobia or social anxiety disorder.
What would that be like? Afraid to go to a party?
Afraid to go to a party, afraid to deal with somebody in authority, afraid to be out in public in a manner that you're going to be noticed and engaged.
So if you've got the social anxiety syndrome type situation, do you treat that with psychotherapy or do you treat that with medications or both? When do you know which to do?
Well, psychotherapy is often helpful. The most evidence-based right now is cognitive behavioral therapy.
Cognitive behavioral therapy, that means thinking and acting?
Yes, I mean, with the obsessions, you may stop some of the behavior. You may expose them and stop their response. And under the right conditions, with you doing this enough and over again, it may dramatically abate.
How about somebody, oh, I'm too scared to go on television. Don't you get panicked every time you go on television, this and that? There are some people that don't want to give talks in front of people and they flush. What's that?
Public speaking or performance anxiety, whether it's going to take the test or giving public speaking, is usually very treatable and usually quickly treatable. I mean, sometimes we simply use a medication, some psychoeducation, and that'd be enough. At other times, they need to have this psychotherapy with it.
Can somebody recognize, let's say you're in medical school and you've got a test that's coming up and your mind just spins and you can't really concentrate because you're so anxious and you're afraid of what the teacher, how do you walk somebody through that?
Well, if it is generalized anxiety, you mean talking about what you tell them? Well, first, all of these have a component of teaching them about what they're dealing with, because often there's a distortion of the interpretation. Like the car alarm keeps going off and nobody's trying to take the car, and you still respond as if it is. So the education, sometimes brief psychotherapy, or that's often cognitive behavioral oriented. If it's general, many medicines that help. In social phobia, there are algorithms or treatment guidelines that help.
Tell me about some good medicines that are there for specific anxiety disorders. So I can let you jump into generalized anxiety, I can let you jump into phobias or panic disorders. What comes to your mind as good treatment out there? I just wish people knew about it.
Well, I mean, for instance, let's take generalized anxiety disorders. You usually refer them to get some good psychotherapy. And for some, it's a traditional psychotherapy that's just by a superior therapist. In others, it's cognitive behavioral therapy. Buspirone, which is a very simple old medicine to take, and generic medicine, may help generalized anxiety disorders. Traditionally, there are a number of the antidepressants have been used for many of the anxiety disorders and OCD and PTSD. They tend to stop some of the broken record aspect of this, whether it's OCD or recurrence. I'm awake again today and I'm anxious and tense again today. And then sometimes you have to go to other agents, hydroxyzine, and we try not to just run to benzodiazepines, but
now,
sometimes
benzodiazepines, that would be your Valiums and Xanaxes in that group?
Clonazepam, there are a number of agents in that group, including Valium, but you don't want a person to spend their life on it.
And is it easy to get hooked on those? Do people to get dependent on anti-anxiety medicines like the benzodiazepines?
That group has a substantial habituation or addiction rate. And it needs to be monitored, and again, the earlier you can get to this, it's often something that's simpler and less. Xanax has a bit more rewarding for the moment, so that's often something we try to move to a longer term benzodiazepine and then hopefully off of them.
Do people ever get hooked on the SSRIs or the antidepressants or anything like that you mentioned earlier?
They're not addictive, but there's withdrawal from, so there can be a habituation with specific ones of them. Sometimes paroxetine or Paxil, sometimes venlafaxine or Effexor.
Let's go through those names. You're used to those a lot, but paroxetine
is Paxil. Paroxetine is a generic Paxil. Effexor or venlafaxine, those are harder to get off. But how you get off of them, again, it's not addictive. It can be in a habit where your physiology expects it, but you just do it slowly if you want to get off of them.
Good. So there are medicines that help, but then you take over with psychotherapy as you withdraw with those?
You take over psychotherapy in parallel.
Okay.
Because you want to get ahead of it and try to prune the medicines.
So it's like everything else. If there's a disorder, you go to the disorder guy. So if you've got a mental disorder, you go to, how do you know if you need to go to a psychiatrist or a psychologist?
Well, the majority of the treatments for anxiety disorders is probably started and sometimes completed by primary care physicians. Sometimes it's treated by psychologists or clinical social workers. And if it's successful in moving along, hooray. But you need to be expeditious in getting after it, because longer there, harder to treat.
Ken Jobson, you make me feel better. You make me feel like I know there's so much out in society that needs mental illness treatment, and yet there's treatment and there's guidance and there's things that you can do for people. Thank you so very much for coming to the Dr. Bob Show. To me, I've enjoyed it too, and I think it's great for people to hear these things. If you've got problems, if you think it's just anxiety that's taking over your life, or phobia is taking over your life, or mental illness taking over your life, talk to your primary care physician. See if you need mental assistance. If you do, don't feel like it's a weakness. Know that there's something that can help you. And now you're going to want to stay tuned. We're going to be talking about how does diabetes harm the eyes, and a bad cough from smoking. Do I have emphysema, or is it just chronic bronchitis, or can I stop? Is chronic anxiety part of your life? You know, anxiety is something that everybody has. Sometimes if we're going to have to perform, give a talk, we have anxiety. Before we take a driving test, we might have some anxiety. Before we have to perform a task, it can make us anxious. It's when that anxiety becomes overpowering and interferes with your ability to function. Now, if you have chronic anxiety, you know, the body is trying to get rid of that. And when the body does that, it can make your blood pressure go up. It can make your heart rate go up. So it puts a stress on the normal body function. So it's an important thing that you seek medical evaluation for. Anxiety is not a weakness. If it becomes a problem, then you may need some counseling to help you get rid of the anxiety, maybe medications that will help you handle the anxiety. But if anxiety is part of your life, know that you can seek medical help and you can overpower that. I want to thank Dr. Ken Jobson. Wonderful discussion on anxiety disorders. If you have an anxiety disorder, be sure that you get it taken care of. Now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, question number one, I'm 43 years of age. I've been smoking for 20 years. I play softball. I go to the gym. I work out. My doctor says I have emphysema. It really scared me. I don't think I have it. Well, that's a good question. Emphysema is the end of smoker's disease or exposure to something at work that damages the lung. It starts off with a simple cough, then it starts off as a productive cough, and then it's a productive cough where you cough up sputum for 6 weeks for 2 straight years. So it's the rattling cough that you've always heard, most often in young males that are smoking, but now females that have been smoking on a regular basis. And then it goes on to where you're short of breath when you're walking and when you're doing activity, and then later on, you're short of breath at rest. So if you're at the gym and you're playing and you're coughing, you're probably beginning the disorder, and so you must stop smoking, and your doctor should get pulmonary function studies, lung studies that will see how bad it is. Then the diagnosis can be made, and there's treatment to take away the inflammation and treatment to allow you to breathe better. So know that if you've got those symptoms, get the proper diagnosis with lung studies and also the right medications. Question number 2, Dr. Bob. How does diabetes affect the eyes? Well, we always talk about diabetes as the most common cause of blindness. So how does it cause blindness? Well, with diabetes, it works on the small blood vessels, and the small blood vessels nourish the eye. So if they're not nourishing the eyes properly, when we look at the eyes, we see some stuff, we call it exudate, on the retina, the back part of the eye. And that stuff called exudate is part of what's happening when the small vessels don't nourish the eye. There gets to be little bitty blood vessels, small vascular blood vessel hemorrhage when you look at the eye, just like you threw a tomato against a wall. It's very, very small, minute, but the eye doctor can see that, and when he finds that early, he knows that's the beginning of big-time trouble with diabetes. If you've got diabetes, you need to have your eyes checked once a year. He can use laser or other treatment to help that. We know that with diabetes, there's also an increased incidence of glaucoma. Glaucoma is where there's increased pressure inside the eye that pushes back against the optic nerve, the eye nerve that allows us to see. That's going to cause blindness. It's often silent. Need to see your eye doctor once a year if you've got diabetes. There's an increased incidence of cataracts. That's where the lens becomes cloudy and the vision just sort of becomes cloudy. That can be repaired, but increased incidence in diabetes. And so diabetes can cause eye problems, retinal detachment because of lack of nourishment there in the eyes. And so diabetes affects the eyes like it does the heart, like it does the kidneys, like it does the lower extremities. If you've got diabetes, be sure you're checking on your blood vessels in the eye so that you'll see well. You've only got two eyes, so make sure that those two eyes are kept in good shape. That's all the time that we have for this show. Remember, we've got to be exercising. Boy, that'll do everything for you. Exercise every single day. Just get up and walk. You know, you don't have to go to the gym. You don't have to put on gym. Just get up and walk. Get out on the street. If you've got a treadmill, jump on that early. Be sure you do it every single day. 30 to 60 minutes, 7 days a week. If you can only do 5, hooray. But be sure that exercise is becoming important in everything. 8 hours of sleep. Now we're saying 7.5 hours sleep. So I'm going to start saying 7.5 hours of good sleep. It'll make you perform better. Be sure that you're eating proper foods. And so start the day off with a good breakfast. And then have a lot of fruits and vegetables. Stay away from that old fatty fried foods. And most of all, what is it that we like in the Dr. Bob Show? Well, it's that laughter in your life. If you laugh a lot, you're going to stay healthy, so you go giggle.